Good morning, everybody, and Happy New Year. Happy New Year. Are we ready to start?
Anytime.
Okay. So good morning, everybody. Happy New Year. I'm Marit Stiles, leader of the official opposition NDP here in the province of Ontario. And across Ontario, more and more people are waiting longer and longer for healthcare. Doctors say emergency room wait times are the worst that they've ever seen. We heard the CMA today speaking about raising the alarms of emergency rooms in crisis across the country, but we know that here in the province of Ontario, things are really desperate. A man in Waterloo region recently had to wait 11 hours to be transferred from paramedic care to hospital. And every day, we are hearing about more people being forced to travel far from home because their emergency room or their urgent care center is lacking the staff they need to stay open. Imagine how scary that must be. If your loved one needs urgent care and it's not there for you when you need it. Rural, remote, and northern communities are hit the hardest, but we're seeing this all over the province of Ontario. Doug Ford and the Conservatives promised to fix the Liberals' hallway medicine crisis, but things are just getting worse. I had a paramedic the other day say to me, we've moved from hallway healthcare to garage healthcare. And the premier needs to stop pretending this crisis doesn't exist. The good news is there's hope, because we can fix this problem. And that's why today I'm delivering a challenge to Mr. Ford. Bring the legislature back and work with us in the NDP to reduce healthcare wait times right now. There are three things that I want to propose today that the government could do to make an immediate impact. First, drop its appeal of Bill 124, and that's the bill that the government has used to unconstitutionally suppress healthcare workers' wages. The government needs to stop spending untold millions fighting healthcare workers in court. It's devastated frontline healthcare. It's showed them deep disrespect, and it is a major factor in what is driving them out of our hospitals, out of our long-term care facilities, and out of our province. Second, the government needs to establish safe nurse-patient staffing ratios. Follow in the footsteps of BC's NDP government and establish minimum nurse-patient staffing ratios to ensure quality of care. This is something that I really quite recently sat down with the BC Premier, David Eby, to discuss. It's a bold step to managing the burden that so many of our overworked healthcare workers are dealing with, and it ensures patients are getting the highest standard of care. Third, cap private nursing agencies. Now, in the fall, we in the NDP introduced legislation to limit hospital and long-term care home spending on private healthcare staffing agencies within 2 years. The government's policies have resulted in hospitals hemorrhaging healthcare dollars into these private agencies. And we know that, certainly in some smaller community hospitals representing, say, 8,000 in a population or less, they are so strapped that they probably can't do that. And in those cases, the government needs to help support this exorbitant cost while we work to deliver more solutions. But meanwhile, we need to prohibit agencies from paying their workers more than 10% above the rate in the public workplaces if we're ever going to retain and recruit workers to our public healthcare system. Now, if we fix our healthcare staffing crisis, we will reduce wait times. But without workers, our hospitals and our long-term care homes, they can't function. And that's why I'm urging the Ford government to work with the NDP, adopt these three simple solutions to improve workers' conditions, to bolster staffing levels, and to fix our wait time crisis. This crisis cannot continue, and Ontarians are demanding better. And with that, I'm happy to take your questions.
Doctors I'm talking to, they say staffing, yeah, it's an issue, but they say the biggest problem leading to the wait times is the fact that we just don't have enough beds to put people in. Like, why isn't one of your recommendations simply that we build more hospitals or more hospital capacity?
You know, I would say, I think that's a little bit inconsistent with what we are seeing across the province. Certainly, there are many factors at play here. But at heart, this is absolutely a staffing crisis. It is an overcrowding crisis, and I think there are ways that some hospitals are managing that bed situation more effectively than others, and some tools that we can learn from and examples we can learn from. But at its heart, and I think you're hearing this from the experts and the frontline workers all across this province, this is a staffing crisis. It is in part because we are without the Ontarians, 2.2 million of them don't have a primary care physician or a nurse practitioner they can go to. It is also, though, very much about the fact that we are losing healthcare workers at an extraordinary rate, and certainly far faster than the province can recruit them. And so all of the measures that the government says that they are taking are not good enough. We are not seeing the increase in staffing that we need to, and we are seeing, again, a consistent over-reliance on private staffing, private nursing agencies, which cost an enormous amount and are hemorrhaging healthcare dollars out of our public healthcare system. I also don't want to lose track of the fact that, you know, we have the money right now in place to be able to deal with some of this, right? To incentivize and recruit and retain the nurses and other healthcare workers that we need to be working in our hospitals. But this is a government that is choosing not to spend those dollars, and this is a government that is choosing instead as well to move public healthcare dollars out of our public healthcare system and increasingly into private clinics. And that's costing us all more.
There's fewer hospital beds now in Ontario than there were 20 years ago. Like, how can you say that's not a big issue?
I'm not saying it's not the issue, but I am saying that it is one of the issues. But look, a bed is just a bed, and it's going to sit empty unless we have the healthcare workers there to staff it. So at the end of the day, if we do not address this staffing crisis, we are going to continue to see this crisis worsen.
With your second recommendation on the staffing ratios, like if there just aren't enough nurses, what happens?
Well, I mean, I think that is what the BC government is doing that's so significant, right? Is they're saying the reality is we're going to set these ratios, both because we see that our healthcare workers are overburdened, and we want to attract them and we want to retain them. So if nurses are leaving the system and other healthcare workers because they are feeling so overburdened, so overworked, and as I've mentioned here before, so many of the nurses that I speak with in our communities talk to me about the moral crisis that they're experiencing as they are put in situations increasingly, you know, where they feel that they cannot provide the care that people so desperately need and the quality of care. So what I hear from nurses and other healthcare workers is these these patient-nurse ratios are absolutely critical to them being able to provide the care they know they can and need to provide. And it's also going to mean, in addition to and in combination with the other measures I've talked about, that we can continue to not only recruit more healthcare workers into the system, but retain them. Yeah.
But does it just mean instead of this hallway healthcare or garage healthcare, as you said, like no healthcare?
No, I think absolutely the opposite. You know, what we are seeing is healthcare workers leaving the public healthcare system, nurses who are moving into private nursing agencies because they can have more flexibility, be paid more, and not have that burden that I've talked about. We need to cap those nursing agencies. We need to push, we need to create the working conditions that nurses want to work in. That will draw them back into the public healthcare system, and so that they can do the work that they want to do in that system. We are hemorrhaging. Like, let's not pretend that what's happening right now, I mean, it's not about money. We are hemorrhaging healthcare dollars, right? And if anything, we have $22 billion that the government is sitting on for a rainy day, and the rainy day is here right now.
We know that hospitals across the country are seeing a lot of these same issues. Is there something unique about the situation Ontario is in?
Yeah, I think when you look at what's happening, other provinces like BC are starting to take measures that nurses here and other healthcare workers here are looking to and saying, wow, they get it, right? They understand the pressure that we're feeling. They're willing to make the kind of change that we need. Nurses in Ontario, and I speak with a lot of them, and I speak to the organizations that represent them, feel deeply disrespected by this government. I mean, this is a government that, let's not forget, has taken healthcare workers to court to suppress their wages. in a pandemic and continue to fight in court. So the disrespect that they're feeling here in the province of Ontario is very deep. And I think when you look at what the government's claims that they're trying to do to recruit more, and they talk about all these numbers, it is clear we are losing healthcare workers, nurses, at a higher rate than we can possibly recruit them. So it is a retention issue as well as a recruiting issue, and we are not retaining those healthcare workers. And as I said, this is part of the Liberals' legacy, right? The Liberal legacy of hallway healthcare in this province remains, but it's worsened. And now we have patients moved into garages, for goodness sake. This is, and I think many of us, Ontario, there aren't many Ontarians who haven't had the experience in recent years of what this means for our loved ones when they're in hospital and when they need care desperately. And I know I'm one of those people who've had that experience with family members. I know more and more people are seeing it. I think that Ontarians are losing patience with the government on this point.
Do you think that dropping the appeal of Bill 124 would somehow reverse that sense of disrespect that you see in your
It would be,
has the damage been done by just implementing it in the first place?
The damage has certainly been done, but if the government were to take some of the actions that I'm talking about today, and including stop fighting them in court, I think that does go a long way, right? It would show some goodwill. And I think that is what healthcare workers, nurses are looking for right now from this government. And I would say, I don't say it lightly, like recall the legislature. Let's get going. What are we waiting for? People in this province expect us to be doing better. We can solve these issues, but the government needs to work with the opposition to get it done.
Or it seems like every single time you hold a news conference when the legislature's not in session, you're calling on the government to bring the legislature back.
Well, yeah.
Is that just a gimmick? I mean, what really legislative-wise can we do on this issue?
Well, look at what the government manages to do, the mayhem they create when the legislature's in session with their bills. Let's actually bring forward some legislation that would do something good. Let's reverse the legislation. They've managed to flip-flop. We've managed to push them to reverse course on nearly every decision they made last year. The one thing we haven't succeeded in yet reversing is the privatization of healthcare in this province. Bring back the legislature. Let's reverse course on that terrible plan, which is going to cost Ontarians more and continue, by the way, to drag healthcare workers and healthcare dollars out of our public hospitals at a time when we need them there the most. So it's not a gimmick. I mean, we in the NDP, we believe that important work can happen here. People in Ontario have maybe lost hope in that because we have a government and government after government that have been so egregious, who have not served them well. But we could be doing good work here, and people in the province of Ontario expect us to.
Let's ask you as well, Martin, about our story yesterday. The government shutting down a number of Service Ontario locations, moving them to Staples. And I guess the reason they gave was that Staples have longer hours. There's still a lot of unanswered questions. But, we've seen this before. Like the post offices, they're in private operations now, too. Is this so bad, do you think, that they're doing
I think what's significant about this, and let's not forget that some of these Service Ontario kiosks already exist within, like, private small businesses, et cetera, right? What's concerning to me about this is how did the government come to the decision to turn to a U.S.-owned corporation like Staples to provide this service to Ontarians? What are the implications of that? I certainly want to know the details of that deal and how and why they chose Staples. When there are certainly already, small businesses in Ontario that have been providing this kind of service for some time, and I would like to understand a bit better about the details of this agreement and how they landed on Staples as a big U.S.-owned corporation to provide this service. Yeah.
And should something like that, in your mind, should it be tendered, or should it be? Do you have an issue with that being sole sourced?
I absolutely think it should be tendered. It should all be out there and clear and transparent to the people of the province of Ontario. This is our personal information. These are really important services that people in this province rely on every single day. And there's many questions I have, but I really do want to understand the details of this deal and how it was that they landed on this U.S. corporation.
Do you worry about the privacy issues with employees in Staples seeing your driver's license details, health card information?
Again, I think there's a lot of questions about the details of this deal, how the government arrived at this decision, and what protections are in place for Ontarians.
Marit, we're expected to see hip and knee replacement surgeries being performed in private clinics starting this year, according to the plan that was announced last year. What are your thoughts, and have your perspective evolved on this specifically?
You know, I would say that, you know, as we've seen the move increasingly to, and we've seen some of the early research coming out now on the expansion of private clinics, my concerns have actually deepened because we believe that those dollars deserve and should be devoted, those public healthcare dollars, to patients in public healthcare and not to shareholders and private profits. And what we've seen in research now that's emerging already is that it's actually costing more to provide those services outside of our public healthcare system. So I think it's actually made me more determined to push the government to reverse course. I think this is irresponsible, especially at a time when we're seeing our hospitals and our healthcare workers in the public system really struggling. The government should be devoting all their time and energy to supporting our public institutions to provide this care.
Just on a different topic, the Solicitor General was out this morning talking about bail conditions and more money into policing for that. Do you have any comment?
Well, look, I mean, we certainly have an issue, I think, when it comes to repeat offenders. I would like to see, real bail reform. I would like to see us talk a little bit more as well, again, less about sort of gimmicks and more about actual work that's going to happen to address this problem. I would like to talk a little bit more about some of the root causes as well. But certainly what I've seen so far doesn't really give me much confidence that the government is on top of this. Okay. Thank you very much, everyone.
Thank you.
Nice to see you.